The next drugs we're going to cover are antacid medications, or drugs for peptic ulcer disease and gastroesophageal reflux disease. This starts in our chapter on page 248, has some lovely pictures to accompany it on page 249. So we are going to talk about 4 categories of drugs for GI acid-caused problems and GERD. So we'll be talking about just regular antacids, the type you can get over the counter. We will be talking about a drug, a category of drug called the histamine H2 receptor antagonists, proton pump inhibitors, and then drugs that are considered cytoprotective. They protect the tissues of the GI tract lining. And all of these have a somewhat different function. The first thing we need to do is just kind of talk about the effect of some of these drugs. We all know that stomach acid issues can be a real problem, especially as we get older. And there are different reasons for that. We, and I include myself when I say we tend to overeat. We tend to eat very large portions. We tend to be heavier than we were even 20 or 30 years ago. And any kind of abdominal weight can force stomach acid up into the esophagus. So we just see a lot more GERD and stomach acid problems than we used to. When it comes to the stomach lining, it's very well protected by epithelial layers that produce mucus. And the acid is a little bit diluted in the stomach with some other stomach juices. It's not just pure hydrochloric acid. But stress or various disease processes can produce an excess secretion of stomach acid. Other things that can contribute to actual ulcers being formed inside the stomach, frequent use of alcohol, other types of chemicals that somebody might ingest, various diseases. Usually the inside of the stomach can heal pretty rapidly because those types of epithelial tissues regenerate. But if you've got exposed tissues and continued high acid, the injury to the gastric lining may not be able to heal. And so we can get various kinds of ulcers. If they're in the stomach, we call them gastric ulcers. Duodenum, the duodenal area of the small intestine, are called duodenal ulcers, or duodenal ulcers if you're British, or and anywhere else through the GI tract that can be exposed to acid. And just generally, they go under the name peptic ulcers. So we have protective medications we're going to talk about that are used by themselves or with other meds to treat peptic ulcer disease, gastritis, which is general inflammation of the GI tract, stomach ulcers, peptic esophagitis, where the mucous membrane lining of the esophagus gets irritated, hiatal hernia, where the top of your stomach starts to protrude through that cardiac sphincter. That's pleasant. Gastric hyperacidity, and then esophageal reflux, where you are kind of getting the acid up into your esophagus, extremely uncomfortable, and we pretty much just call that heartburn in layman's terms. So one of the first types of medications that we'll talk about, and you can find this in the table on the bottom of page 249, are just regular antacids. And an example of this would be Tums, calcium carbonate. You'll see a lot of over-the-counter tablets that can be chewed or left to dissolve in the mouth. And many times these are made up of various kinds of minerals. There's magnesium, there's calcium, there's aluminum, sodium bicarb, just plain old baking soda. But all of these do the same thing, and that's to neutralize the hydrochloric acid in the stomach. We are increasing the gastric pH, making it go from like 2 to 4 to slightly higher. That decreases the acid and inhibits another substance called pepsin that help stimulate the production of stomach acid. So the prototype drug would just be, in this case, calcium carbonate, Rolaids, Tums, Maalox. And these can be very effective for the person who just gets an occasional bout of, heartburn, in quotation marks. However, if your GERD continues and you can't really get relief, and it's even getting to the point where it's causing ulcers, you need to use something a little bit more heavy duty. And that's where we get into the histamine H2 receptor antagonist. If you remember, I talked about different kinds of histamine receptors. The H1 receptors tend to be in the respiratory tract, so we talked about antihistamines for those. And these particular receptors, the H2 receptors, are mostly found in the GI tract. So if we can get a drug that's a histamine H2 receptor antagonist, that displaces that histamine from the receptor site. And so the histamine stimulates the little secretory cells inside the lining of the stomach to produce acid. And so if we can block those, not as much acid is produced. The acid that is produced is neutralized, and it gives a chance for stomach ulcers to heal. Our prototype drug for this is Pepcid, or famotidine. The H2 receptor antagonists for a long time were prescription only, and then, 15, 20 years ago, they became available on the shelves. And now they have store brands. So, you can buy acid reliever, and they all end in the name, or the letters D-I-N-E, Dine. So, of course, they're usually said Dean. So we have famotidine, nizatidine, ranitidine, cimetidine, and all of these are effective for blocking those particular H2 receptors in the GI tract, keeping histamine from stimulating acid production. So our prototype drug will be Pepcid, and you can get tablets that are very effective. The last category is kind of a more heavy-duty category. These are known as the proton pump inhibitors, or PPIs, and these are also covered on page 250, right in the middle of the page. Our prototype drug is a drug called pantoprazole, or Protonix, and this is usually given IV. There are a few proton pump inhibitors now sold over the counter. They're still pretty expensive, but they can be effective if the doctor orders them, and there are some that are given in the clinical setting. Now, the lining of our stomachs is filled with all these little, what are known as proton pump inhibitors, and they're embedded in the lining of the stomach, and when acid production is stimulated, these little tiny proton pumps put out acid. So think of just rows and rows and rows of millions of little like gas pumps. So what the proton pump inhibitor does is just take that little pump and turn it off. Sort of like when you take your gas pump and you put take the handle and you stick it back in the pump stops. This does that permanently. Now, we have millions and millions of these little proton pumps, these acid secretory pumps in the lining of our stomachs, but these drugs will turn them off permanently. So they're used in short-term treatment of active duodenal ulcers, and that is usually after antacids and H2 receptor antagonists, and then some of these cytoprotective drugs we're going to talk about have not worked. So proton pump inhibitors are usually given kind of as a last resort if the person keeps getting ulcers and they're not responding to other treatments. But pantoprazole, or Protonix, is going to be our prototype drug for this. You might recognize the names Nexium and Prevacid, which are also found on page 250. Make sure you read those nursing implications for those too. The next category is found at the very bottom of page 250, and these drugs are called cytoprotective drugs. When you're talking about cyto, you're referring to cells, and these drugs kind of protect the tissue in the lining of the stomach. We see there's a couple different kinds. There's sucralfate or carafate, protects the lining of the stomach, protects the cells from further damage. It forms a protective layer over the ulcer site. Bismuth salicylate is Pepto-Bismol, the pink stuff. That also coats and soothes. Remember that it contains a salicylate, chemically similar to aspirin, and so it's not recommended that children with viral illnesses take this. One interesting drug that started off with GI uses and now you see used as an off-label drug in OB is a drug called misoprostol or Cytotec. It's a synthetic prostaglandin, and it stops some of the irritation that causes acid to be formed. However, it was found when they were testing this drug that it caused violent pregnancy loss in test animals. And you'll see on the package, never give to pregnant women. It can induce spontaneous abortion and later preterm labor. It also has OB uses in very small amounts that you will discuss in senior rotation when you get into your OB rotation. We'd cut a Cytotec tablet into quarters, and it would be instilled behind the posterior fornix of the cervix, and as it dissolved, it irritated the cervix to where it would bring on contractions. And so it was kind of disconcerting to take a package out of the AccuDose that said, absolutely contraindicated in pregnancy, and know that we were going to go stick it in a pregnant patient. But there you are. But for GI use, it's very effective, protects that lining by decreasing the effect of prostaglandins, but don't give it to anyone pregnant. With these particular drugs, you want to drink a lot of liquids. Watch for stools to darken with Pepto-Bismol. Your tongue can get black and your stools can be dark, which can make you think that you have internal bleeding. And then with bismuth salicylate, you can end up with aspirin overdose symptoms. So that can be kind of dangerous too. You'll see, what would you see first? Your ears. Yes, ringing in the ears, and that tells you, lay off of the pink stuff. I've got to stop here because we're getting up into past 12 minutes. So my next recording will go on with this theme.